Okay, good evening, everyone. Today is 29th of September 2021, and it's the World Heart Day. And that's the reason why we've got all of us assembled today, this evening, to have a chat of the heart by the heart. And I have with me the cardiologist from the Fortis group in Mumbai. The galaxy of stars which I have got here today are actually looking after the hearts of all our Mumbaiites in the four corners of the city. So if I was to introduce just the way I'm seeing them on my screen, I've got Dr. Brajesh Kumar, who is a senior
Hello, good evening.
consultant
Yes.
who is practicing at Vashi Fortis. I've got Dr. Atul Limai, who is a senior consultant practicing with us at Fortis Mulund. I've Dr. Hasmukh Rawat, very senior consultant, who is basically practicing with us at Fortis Mulund. And I've got Dr. Vivek Mahajan, who is a consultant practicing with us at Fortis Kalyan. We may have one or two more cardiologists join us during the session. And welcome all. And thank you very much for finding this time to sort of just be with us and answer the questions and have some thoughts on how to look after the heart. I'm Dr. Rahul Pandit. I will introduce myself. I'm the Director of Critical Care at Fortis Hospital, Mumbai, and I'm going to moderate this session. I'm going to start the session by actually a very short 2 or 3 slide presentation, if it's okay with you, because in last 3 months, Fortis actually has been looking forward for the health and well-being of the citizens of Mumbai and Maharashtra proactively. We have been actually conducting some studies, some surveys to actually understand how people have been in the last 19 months of the pandemic and how concerned they are about their health and what are the problems they are facing to deal with in terms of taking care of their health. So this survey, which I'm just going to share, basically was surrounding this.
रवि मैसेज करो मीटिंग में हूँ.
Can you see my screen? The slide?
Not no, no, Rahul. We are
No,
not seeing anything.
no,
You're not seeing my slides?
No,
no.
no, we are not.
Now we
Now
can.
something. Yeah, we can see now.
You can see the slides now. Fortis Healthcare Mumbai
Yes.
survey. Thank you.
Yes.
Yes. So these are the 3 slides which I want to prepare, want to talk about. This is the survey which I was just mentioning. So aimed at gauging Mumbaikar's awareness levels and preparedness for a cardiac event, Fortis actually proactively across the city conducted a study from June 2021 to August 2021. And we actually managed to get a sample size of around 7,864 patients, obviously all adults above age of 18 and above. We had 41% who were females, 59% were males, and majority of our responders were between the group which we actually know, the technologically savvy group, the 31 to 40. Though the youngsters would be more technologically savvy, but obviously they may not be so conscious about the heart related issues. But a bit one between 31 and 40 is actually the age group we are looking at, because they are the ones who are really wanting to know how the future is for their heart and the well-being of their heart. The study revealed that 85% of those studied understood modalities of seeking medical aid, while 15% lacked a complete understanding of that. And this is what the whole survey basically showed. So we actually divided those responses into 4 or 5 different categories. If it was a COVID-19 related finding, we found that around 53% believe that COVID worsened the risk of heart ailments. 63% believe that COVID made it unsafe for them to walk and exercise outdoors, especially with the existing heart condition. And 72% believe that their heart disease may get severe if they got infected by COVID-19. Now, that's a very, very valid concern. We've always been talking about patients with high risk actually having a difficult outcome with COVID-19. A lot of them had a change in their working pattern, and almost 65% understood that sitting idle for long times was not very, very good. 20% who regularly exercise believe that sitting for work for a few hours was not going to be detrimental for their health. Similarly, how were they monitoring their health? So around 21% of the Mumbaikars relied solely on their home monitors like blood pressure machine or pulse oximeters kept at home. And 53% Mumbaikars had not undergone any form of health checkup during the pandemic. So 19 months, no lookout for their own problems, whereas we have been stuck at home. So obviously these 53% Mumbaikars had no contact about their own health checkup in any hospital or medical setup. Emergency response related, 43% patients said that they would check symptoms, call an ambulance, and take a patient to a hospital. It was heartening to know that one-fifth of the population approximately knows how to give CPR. 15% were unsure of the symptoms and the next steps they want to take after that. And 19% believed that giving the patient an aspirin would be the best thing to actually do. As far as preventive health checkup related questions were asked and answered, 73% believe that 30 to 50 is an ideal time for both genders to opt for preventive heart care check. I think that's a very, very positive answer. 75% of them believe that. 14% believe that keeping a track on one's health status was not really important if there was no family history of any comorbidities such as diabetes or heart ailment. Was it gender specific? 69% knew that gender specific factors do increase the risk of heart disease. And 51% Mumbaikars believe that women were less likely to have a cardiac problem or take medicines regularly or have a cardiac rehab. Last but not the least, the risk factors related, the questions were basically answered in a very, very prompt way because 75% were aware of the behaviors and conditions that increase the risk of heart disease. 82% knew the lifestyle changes that needed to be made to have a healthy heart, but 40% didn't have enough time to to exercise. 36% tried but could not continue, and a small percentage of 6% people found it to be extremely boring. With this, I'm just going to stop my slide sharing. Um, am I visible on the screen again? Just normal screen?
Yes.
Yes.
Yes. Thank you very much. With this, let's start up with our questions. And I'm going to ask questions in a random fashion. I'm going to begin with Dr. Limay. Dr. Limay, tell us how health monitoring took a hit during the COVID 19 pandemic when people only relied on home use devices to understand their health. Was it the right thing to do, or they could have basically done a little bit more? So, the survey actually says that a lot of them just relied on the home care equipments which were available and never visited a doctor. Where they're missing out on something important, sir.
So let me take you back to March of last year when the lockdown happened. And the thrust of the public messaging starting in March of last year was stay at home, do not leave your home unless it is absolutely essential. And this was paraphrased in Hindi, Marathi, and other regional languages and dialect, and was prevalent across our entire nation. And therefore, there was a sense of fear, rightfully so, that you should not step out of your house. And people took that to mean not step out of the house even for regular health checkups or regular medical related activities. And we have done discussions previously about how people have ignored cancer conditions. And similarly, people have also tended to ignore going for heart healthy checkups or any other checkups to their regular doctor, leave alone to their cardiologists. And I think when the vaccines became available in January of this year, and as people started to get their second dose of vaccine, say 2 or 3 months later, I think the public health messaging probably needs to be changed a little to say that now that you've been vaccinated, it's probably okay for you to wear a mask and go out and do your requisite health checkups. Because
Fair
clearly,
enough.
this home monitoring business has not really worked. And we have seen countless examples of patients who have had heart attacks or strokes which may have been prevented had the original public health messaging been, go to your doctor, do your regular health checkups. So it's nobody is to be blamed for that. It is what it is. It was appropriate to have that health messaging back when the pandemic started. But I think you will agree that it may be time to tweak that health message a little now that many of us are vaccinated, and perhaps ask our patients to resume health checkups and start going to their doctors for regular health monitoring.
Very, very well said. I think the bottom line is that healthcare or home care devices which the people were using were obviously not going to be enough. We needed more than that. I think I take that point very well. Rawat sir, I am going to come to you for a question. The survey also mentioned that almost 63% of the people found that it was unsafe to go out for a walk and exercise. What's your take on that, sir? I mean, yes, it might have been unsafe initially, but now with the vaccination being put up and people actually trying to resume their normal life, would you have some advice for them? And if they were not really able to go out of the house, what could they have done at home, and how they could actually still look after themselves? A little bit of pearls of wisdom from you, sir, on that.
It's a very interesting question. If you look at the pandemic, if you look at the March to August, September onwards, everybody was in fear because there was a lack of understanding of the disease. There was no certainty of the medications. Everybody was not sure about how the COVIDs are managed. So that gave fear to the people. And obviously, the people, and there was a lockdown at multiple places. So people had a fear and people had a protective approach to their life and they did not walk around not much for a long duration. Definitely gets more problem like obesity. I've seen a couple of patients putting so much weight, exquisite, not moving around the COVID pandemic. Then obviously the blood pressure also is another issue. Sugar has gone high. A couple of issues came. So that was the reason, main reason. But as Dr. Atul mentioned, as the time passed, vaccination came, people started moving around. I personally feel that if you are unhealthy, if you have risk factors, if you have some sort of a cardiac procedure done, and if you are doing some sort of exercise, walking exercise, some sort of exercise, one should have maintain it. How to maintain it is probably walk in the house, probably get a good mask, walk in the corridor, or even walk in the society's downstairs. May not go out with many people. That could have prevented from the couple of issues. Now, as the pandemic is quietened down, I think the risk has become less. People have become more bold to go outside, not for exercise, other thing, but they are going outside for exercise for so many things. So we see a lot of people have encouraged to go out and started doing regular exercise. Of course, two things has to be kept in mind all the time: that social distancing, and the second is the mask. One should not go with a group to go for a walking, keep on chatting and go for walking. Go walk alone with social distancing, keep the mask on, and that's a good thing to do it around and maintain your health. That's my message.
Fair enough, sir. I think that's a very good, important thing to say, that you should not be neglecting your routine exercise. And exercise could have been easily done while people, many of them actually walked on the within the confines of their house, or they actually chose to go on the terrace and walk. But there were times when those restrictions were in place as well. Coming to Dr. Brajesh Kanwar. Hi, Dr. Brajesh.
Hi.
Just taking it from what Rawat sir said, uh, the work from home culture, which sort of set in automatically, we were compelled to do that. Not us as doctors, but 98% of the population which was working actually had to do work from home. Do you think that sitting for a long duration at one point, at one place in the house, actually saw a lot more diseases worsening, or was in fact detrimental to the health? And it might be just to the physical health, might be even mental health, or the mental well-being of the person, then causing more problems to the physical well-being. What are your thoughts on that?
So, all of us have a lot of corporate patients, and most of them will say that when you work from home, there's no time limit. See, when you go to the office, you go at 9 o'clock, come back by 5 o'clock. So you have a time limits. So when you work from the home, you're almost working whole day, and that too sitting on a chair. If you go back and see the literature, there was a study which said that if you sit 10 hours a day on a chair, even if you take breaks in between, but if you sit 10 hours as a total, you are prone to get cardiac problems. So here there are people who are sitting continuously for 10 hours a day, and sometimes that is not enough. People are crossing that, and still the company feels that the person is still at home, is not working. So that definitely has, and another aspect of this is when you go to a place like an office, you have so many colleagues with you. You take a break, you come out of that office, you talk to multiple people. It sometimes relieves your stress. You feel that you're working with a team, and when you are individually sitting at home and hardly anyone else to talk about, then it's really a stressful job. So I feel definitely yes, the this whole pandemic has brought a really stress, and one of the reason was, I think, working at home alone, not having much people around to talk. Of course, yes.
Yes, I completely agree with you. I think long hours, sitting long hours, probably not counting your number of hours which you are sitting, and then corporate giants actually squeezing more and more time out of people's daily life, probably led to an increase in the problem. On this note, I would like to welcome Dr. Nilesh Gautam. Dr. Nilesh, welcome. Dr. Nilesh Gautam is a cardiologist practicing at SL Raheja Hospital and Fortis Hospital, Mahim. Nilesh, welcome. We started up the proceedings with that.
Good evening to you all. Good evening, Hasmukh sir. Good evening. Nice to see
Good
you.
evening.
Yeah, yeah,
Good evening, Nilesh.
yeah. So I'm going to ask a question. Actually, I was meant to ask the question to Dr. Zakia, but she's not joined. So I might as well ask this question to Dr. Rawat first, and then go to Nilesh and Dr. Vivek Mahajan after that. So Rawat sir, in the context that Dr. Kuwar said that people were not opting to go out, they were sitting for long hours, preventive health checkups were not done, which Dr. Limay also mentioned. You also mentioned that. Do you think that we are actually looking at a heart crisis in the long run, or you think that these 19 months are not going to be really a problem? If we sort of pick up from here, we will still be able to have a reasonable amount of health covered for most of the people, and they could still go back to what they were before.
No, obviously, the what you said is absolutely right. There is always time to reverse the situation, I believe, and that's the best time to understand and reverse the situation. What has happened last 13 to 16 months is really not good, basically. If you look at the risk factors, it doesn't mean that you are sitting for a 3 months for 10 hours and you are going to get heart attack, or you are not walk for 3 months, you are going to get heart attack. These are the long-term effect on your heart. And what Dr. Rajesh said is very, very nice. I think sitting long duration or not walking, it's not good for overall period of long term because it increases your risk factors. Simply, anybody who walks for 45 minutes, 3 to 4 times in a week, brisk walking also makes a lot of difference to his health. It makes difference to his diabetes, blood pressure, HDL cholesterol, and couple of other things. So that is what is essential, and these are the long-term benefits. Now, coming to the pandemic, it has happened so much bad thing that people haven't gone around. Their cholesterol has gone risen so much, and their blood pressure has gone high, and obesity has come around. Some people consciously appreciated and realized these problems and started to reverse the them. It's not going to like it's going to next 6 months if we get more heart attack or something, but it's not a good thing to have it around because ultimately it accumulates and accumulates the risk factor for a long duration. So those who are appreciated and taking appreciating and understanding their heart problems and understanding risk factors, they already done it. Probably those who have not done it, those who are still on the ignoring, as your survey says, still doing the homework and not moving around much, not doing exercise, is not good. Other problem, what Brajesh has said, and I'll edit up, what has happened, people used to go in the office, they used to move around, they used to move around, meet, a lot of things have happened. And from the office, our duration was limited, from 8 hours, 9 hours, they will work for 7, 8 hours, 1 hour's relaxation, lunch time, all the things. What I observed and listened from the people, the relatives, in the house, they work for more hours, basically. They work for 10, 12 hours.
That's what
And
Dr. Brajesh said.
this
Yeah.
thing, the targets are not this. All the things are cumulatively going to be a problem for a particular patient who is destined or going to have a problem. Those who are risk factor, hypertension, diabetes, cholesterol, they should take it more seriously and start reversing and get back to the normal fitness as early as possible. Thanks, Rahul.
Brajesh, you wanted to add
Yeah, I
something?
just wanted to add a small thing. As you said, this topic was very important. You said 1.5 to almost 2 years, people have not done exercise. And also, what I wanted to tell, even to my patients, also, what I say is this exercise, what you do 45 minutes a day, if you don't do it, don't think it is gone. It gets accumulated. The time you spend for your exercise is getting accumulated. And if you don't do it, this minutes will become hours, hours will become days, and days will become weeks. And that same amount you will have to spend in hospital for your health. So better to spend daily rather than accumulating it and getting spending it in the hospital. So that is what I feel, that 45 minutes a day, what sir said, is very, very important for all our patients. I mean, if you say that 2 years I have not exercised and after 2 years I will start and it is not going to impact your health, I don't think so. It is going to impact your health because at 45 minutes per day you have accumulated, and those have become weeks and months.
Sorry,
Absolutely.
just to add up, not only on the patient, Rajesh,
Hmm.
even the normal healthy individuals who have crossed 35, 40, this is the dictum. They should
Yes.
start
Yes. Health for
taking
all.
care of
Health
this
for all,
at
isn't
today's
it?
age, basically. So
Yeah.
obviously, if you don't do it and this sort of a pandemic goes for a long time, it's going to be a disaster situation. So start working on the body 35, 40, because atherosclerosis blocking process start particularly at this age, and you can
Right.
control or reverse the things which is going to happen to you. So as early as possible, what Rajesh said, start exercising and putting in practice. Thank you.
Sure. Dr. Nilesh, I'm going to get you in. Do the root cause of this
Yes.
whole problem lies in the fact that people are ignorant that what a cardiac emergency is. That they're not exercising, they're sitting at home, they're not realizing that actually it's causing them harm. So,
Right.
are they ignorant of what a cardiac emergency is? Dr. Mahajan, you are next after this. So I'm going to ask you a question after this. So, Nilesh, up to you first.
Um, as far as ignorance is concerned, and especially we are talking about urban and Mumbai population, I would say laziness more than ignorance, because most of them are aware, and the media and newspaper and social, the Insta, Facebook, everybody is on it, WhatsApp. So like we had a gentleman, young individual, post exercise and sitting on the steps and falling down at one of the gyms. So everybody was circulating, and suddenly that spurt came that, yeah, 1.5 year we've been sitting, and now suddenly everybody started walking. So there is no doubt as to what the other colleagues and Hasmukh sir has already mentioned, but to have a different perspective, after the first wave of lockdown, COVID wave, there were, so where have all the heart problems gone? So suddenly it was that, yes, nobody is exposed to stress, everybody is at home, everybody is having good food. So we presume everybody is exercising and all heart diseases disappeared. Well, that was not true. It came back once the sort of lockdown went away, and with a vengeance. And then the data came out that how many patients we lost, because again they were afraid to go to the hospital. So as far as I'm concerned, people are aware. But yes, if the patients we come across in the hospital or our clinical practice, you ask them, are you aware of a CPR thing? Yes, I'm aware. If I suddenly have a heart attack, we must do CPR. What is CPR? What are you going to do? What are the steps? Oh, sorry, we don't know that. So that's the kind, they are aware, but nobody wants to go into the depth and find out. And a lot of patients, they come up saying immediately, we keep these two tablets. So I always tell them, but check the expiry of sorbitrate and aspirin, because once they buy it, or I tell them, educate themselves, keep it
Stays
in
for a
the
long time.
society at least. Yeah, it's gone 3 years and it's still that one strip is there.
So Nilesh, you actually are saying that a very important point which you actually said, that when it came back, we lost a lot of patients. Now that's very, very sad, because if we are 19 months later, 18 months later, we had a spurt in our cardiac problems and we actually lost a few patients. Is everybody, Dr. Atul, Dr. Rajesh, Dr. Rawat, and Vivek, all of you are seeing the same trend as well, that you are actually seeing an increase in the patients who are coming very critical or maybe even losing lives?
Yeah, I agree with Dr. Nilesh.
Yeah.
Yeah,
All right.
Atul agrees that we had a bad time, and now we look at the things the way disease get. A lot of acute heart attack. We are getting probably one of the highest number of PAMI we do in the city of Mumbai. Atul, sometimes Atul is a forefront, but we do almost 20 PAMIs a month. That suggests that there is definitely more incidence of heart attack at the end of the pandemic. More severe disease we are seeing probably is a part of the ongoing pandemic process, and the carelessness and laziness towards the health, mostly, probably, possible. But yeah, there are some effect of pandemic on the cardiac risk factor, cardiac health, and we should tighten our belt and get the more awareness about the things. risk factor control, heart factors control, and other parameters, how to get around the fit that we need to control more things.
Right. Vivek, I'm going to ask you. The survey also talked about gender differences. Okay, so
Yeah.
how do you think the cardiac emergencies are different for men and women, and how do genders access healthcare? So, how do men access healthcare? How do women access healthcare? Is it still that women are not really getting an access to the healthcare in the general in the society? I'm talking about.
Yeah. So this survey was one very good thing that was done by Fortis, and one of the most important part of this survey is this gender specifics questions that they have asked. Now, why is it important? Because females or women are 50% of our society, and females are not the copies of males. They have a separate set of problems, separate presentation of the problems, and separate set of behavior by themselves, as well as the society, as well as the medical care towards them. So, if you consider the females or women, the initial part of their life when they are young, they are fortunate enough to be protected against cardiovascular disease by hormones like estrogen, and these hormones keep them safe from cardiovascular disease as compared to young men. So, young men have a higher prevalence of cardiovascular disease, incidence of cardiovascular disease as compared to the young women. But this blessing is in fact a curse in disguise. After menopause, when the hormones are lost, when the estrogen is lost, there is a rebound of the disease. There is an increase in the diabetes. There is an increase in the bad cholesterol, which the hormones are protecting from. And this results in an increased cardiovascular risk in the females post menopause. So much so that they outpace the men after a few years, 50 or 60, and in fact the benefit that they have enjoyed in the initial phase of life, it is totally lost, and in fact they overcome the men, and they outperform the men in terms of cardiovascular risk. So issue does not end here, the curse does not end here, it extends further, because it gives a sense of overconfidence or a sense of complacency or a sense of being safe for the young females. So the young females do not take that much of a preventive advice seriously. They do not modify their lifestyle. They do not exercise. They sit for long hours, and therefore, by the time they are menopause, postmenopausal, they have already accumulated a lot of risk factors. So they suddenly change from a safe zone to a very unsafe zone. Moreover, the risk further continues when the patient or the female has a heart ailment. Now, these females, when they have a heart ailment, they tend to again ignore these symptoms because they are safe from the cardiovascular disease. They believe so. Even when they present to the doctors also feel that maybe this is a female, it is a gas or acidity, and probably I should not go very seriously about this.
So, Dr. Mahajan,
But
just go slow because your voice is cracking in between. So, it's sort of
yeah,
in
sorry.
between, it just cracks up.
Yeah, sorry about that. So, even if the female presents with a cardiovascular complaint, the symptoms in the female or the women are slightly different as compared to men. So, the typical crushing chest pain is usually not there. They may present with just a fatigue or a anxiety, or they may present with a abdominal discomfort or difficulty in sleeping or just sweating. So the symptoms are also very in a deceptive manner in females as compared to men. So this makes a diagnosis of
No,
cardiovascular disease very difficult in females. Even the tests that we do, like stress tests, they are not very informative in females. Moreover, when it comes to treatment, the curse doesn't end here. When we do an angioplasty for the females have a smaller coronary arteries as compared to men. So we have to put a smaller size stents in females as compared to men. And the smaller the size of the stent, the future complications are more. Moreover, the females have a lot of microvascular disease, which is not treatable by angioplasty, and this gives a poorer long-term prognosis for the females as compared to males. So even if you have treated the females successfully, the outcomes are poorer. The drugs that you give to the females during a heart attack, they have more side effects for the female because females have a smaller body surface area. So overall, if
sure,
a female
sure.
surface
So there
suffers,
are there are significant amount of gender disparities between the two groups. I'm going to have
yeah,
a rapid fire round very quickly. Just I want one, two line answer, and I'm going to start with Atul first. There are a lot of viewer questions, and this is where I'm going to do rapid fire. So, Dr. Limay, essentially one of the viewers is asking is no, I'm going to take Gayatri's question first. That how frequent should one have a heart disease screening done for the one who was COVID positive and had BP, blood pressure issues? So the question is basically very simple. COVID-19 patient with blood pressure, how many times, how often should they actually do their heart screening?
Well, I think it's not a single answer because I think it depends on the age profile and other risk factors of that particular patient as well. But broadly speaking, I would say if somebody has had COVID infection and has either had a moderate to severe infection or been hospitalized, at least once
At
they
least
should
once. Okay.
at least once they should visit
At
the
least
cardiologist.
once. Fair enough. Uh, Rajesh, next one is for you. Quick one or two line answer only. Cardiac arrest in young population is on increasing trend. And when should a person start the screening for the heart? And how often should a heart check be done? So young people in their 30s, in their 40s, when do you think they should actually look at? We're looking at a lot of patients now in their 20s and 30s who are losing life, and the
Yeah.
for that has been termed as heart related causes.
See, to be very frank, if you we are seeing a lot of young patients with heart attacks. So I feel 20 years we should have one health checkup, because you can have familial hyperlipocholesterol. So you need to rule out genetic causes also. Suppose you see a patient at the age of 20 years with a very high cholesterol and you start treating that patient, you may save him a heart attack by the time he reaches 30 years. So I feel we should have at least one checkup by the age you are 20 years. Let's check your cholesterol, baseline ECG, echocardiogram, and of course possible stress test also. Then if you feel everything is okay, then probably you can do it once in a year or twice in a year. That is what.
Okay, fair enough. I think so. One checkup at 20 to just look at when there you have any familial problems or not. Rawat sir, next question is for you. Majority of
Sure.
Mumbaikars believe that the heart disease may become severe or more complicated if they have an infection of COVID-19. Is it true? And is it true in those population as well who already have heart element? This is a question by Priya from the
See,
audience,
there are
from
two
the
aspects
listeners.
of the disease process. COVID has two aspects. One first question is whether COVID makes you more prone for the heart problems. Yes, those who die because of COVID, majority cause is heart problems. So remember, COVID do increases the heart problem, and couple of heart problems that you can enumerate is one is as you know, COVID is an immune process, some sort of a body reaction to the virus. It produces something like a clotting in the various blood vessels. Similarly, the way it makes the blood clotting in the lungs vessel, it also makes the clotting in the heart vessels. It also makes clotting in the major lung vessels. When it makes the clotting in the heart vessels, one can get heart attack. It just because of the clotting that has occurred, and you get bad outcome. Similarly, clotting occurs in the main lung vessel, which is called pulmonary artery, and what we call as pulmonary embolism is a dreadful, deadly disease for anybody. So these are the various manifestations. Apart from simple alteration that Dr. Atul said is like a fluctuation blood pressure, fluctuation heart rate, post-COVID can have. So definitely COVID
Sure.
patient do have apart from the lung symptoms, apart from the other symptoms, heart is the priority. In those who get heart problems, they'll end up in a major issues. Those who risk factor, especially diabetes, hypertension, obesity, they tend to get more heart problems and they tend to more go in ICU compared to the observation in the ward. So that is one aspect of the disease process. Now, second question is, with the patients of the heart disease are more prone for COVID? Answer is plus minus yes. Some reports suggest that it do one because risk factor, multiple risk factor, diabetes, heart disease, hypertension do alter your immune response, and you can more prone for the things, but not definite evidence. Probably yes, and you should. For those who are risk factor, they should take definitely more protection for the COVID compared to those who do not risk factor. So either way, it can affect. And bottom line is that if you have the COVID symptoms earliest,
So
especially young people, go to the COVID doctor. Rahul Pandit is the best guy in our place. Go to him and check and get admitted, start treatment as early as possible to prevent yourself from the major heart complication. And those with the heart problems and other risk factors, overall things, they should take more precaution for their heart, for their body, and get away from the COVID. That is what is my message.
sure, sir. I think you've said it very well. Quick question for Dr. Nilesh and then for Dr. Vivek. So, Nilesh, one of the listeners, Siddhi, is asking That's the similar sort of a question what Vivek actually answered, but I'm going to ask it to you, that women are less likely to attend cardiac rehab sessions. So this was something which a survey which we did actually showed. Is this just a behavioral trend, or is it just that women have traditionally thought that they are strong-hearted than the men, and they're unlikely to have a cardiac illness? Which Vivek partially answered the question, but maybe another thought from your side.
I would like to divide women population into two: corporate versus non-corporate, or financially independent and dependent sort of. So if you have a sort of a person who's into the corporate world or financially independent, then her access to a health care worker or any investigation or procedure is much more positive if compared to a non-working or a household lady, is what I have seen in my clinical practice. This stems from the fact that she is always going to be in the background, and if extra expenses, it's going to be a burden on the family, and hence women reaching the hospital or a doctor for any healthcare, or for that matter an event happening, and yes, after the event going in for a rehab, is much less. Pathological differences and management wise differences between the male and female have already been highlighted, but
Yes.
these are the social issues, and day to day clinical practice is what I have seen in my practice.
I think very important point you brought out, that financial independent women have a different kind of approach towards their healthcare. I think very pertinent question, a very pertinent issue. Sorry. Last rapid fire, and then we go back to our questions on based on what we have found. So this is for Dr. Vivek. We are seeing an increasing number of patients who have had COVID-19, and then post COVID-19 have had significant problems in controlling their diabetes, especially, and a little bit of blood pressure. This question has been asked by Sarbasnu. Why do you think that is happening? If you can just highlight that a little bit, and how is it ultimately going to affect your cardiac problem?
Yes, so there are so many issues which can lead to a uncontrolled blood glucose levels post COVID. Firstly, there are some medications which are being given during COVID, like steroids, which leads to an uncontrolled blood glucose levels. Many a times, the COVID also affects the pancreas. Some patients do have pancreatitis, and it may lead to an inflammation and lead to an uncontrolled blood glucose level. Patients do become much lazier during the post COVID period, and they do not get back to their exercise routine. Once you stop exercising, there is a significant fluctuation in the blood glucose levels. So if you are exercising well, your blood glucose levels are going to be controlled. But if you are going to be indoors most of the time, giving up the exercise, then the blood glucose levels are going to be fluctuating and increasing. So the most important thing is that if you are having a fluctuating blood glucose level, see your doctor, get it controlled, go back to an active lifestyle wherein you exercise daily and get your blood glucose levels controlled.
Sure. So I'm just going to go back to our survey and the questions surrounding this. So let me start this time with Dr. Brijesh. So Brijesh, we talked about cardiac emergency, we talked about the gender differences and stuff. Do you still believe that the root of this is that people remain unaware of the risk, which basically impacts their heart? And or do you believe that they are unaware and they are probably ready to make a change now? Their lifestyle may change now that the things are opening up, now that health has been in such a large amount of focus in the last 2 years, that everybody's got conscious about it. And do you think a positive impact can be brought about, changing people's lifestyle, taking pandemic as a center point?
You are on mute, Brajesh.
Just you're on mute.
Absolutely, I feel the pandemic has made us realize that the most important wealth or treasure you have is your health. I mean, you can have tons and tons of money with you, but you don't have a health. There is nothing like that. So, health is important, and we do see this in our OPDs also. If you see the number of patients coming to our OPDs, it has gone up, and there are people who wants to get them checked up. It's not always that they have a disease that they wanted you to be treated. They wanted their heart to be assessed. So we started seeing a lot of health checkup patients. We started, and I think there is another reason, not only the pandemic. Now the recent incidents of cardiac issues in our, I know, media, some people, in TV actors getting heart attacks and all those things has also impacted a lot.
Yes,
But yes,
yes.
I do see a lot of patients coming now, and
Mhm.
probably people are also who have not checked themselves for last 2 years. They also wanted to check, and when they're getting it checked through a local, any lab and all, and they found their cholesterol being very high, so that is the time they immediately rush to us in the OPD and they want us to be treated them. So of course, the pandemic has brought health related issues, and if you see, the media has a lot of role to play. I mean, see, we are talking a lot about everything about this in news. A lot of heart attacks been happening. So yes.
So, no, no, Brijesh, what I was wanting to actually allude to, and I think it has actually being a positive impact that the health has been highlighted so much that people probably become more aware and conscious of their health. Do you also
Of
feel the
course.
same way that you can actually
Yes.
utilize this
Yes.
opportunity to highlight it?
Yes, absolutely. Yes, it has brought the importance of health, not only the cardiac health, but overall, the people are
Overall?
more worried about their health. They are not only they're worried about the cardiac status. I see health checkups also being increased. So I feel yes, the priority nowadays is of course health.
Yes, yes. So next question I'm going to ask to Atul. Dr. Limai, 40, the survey also brought out that only 14% of Mumbaikars thought that if there was a history of diabetes or hypertension, only then there was a need to go and do a health checkup. Whereas 53% said that they did not go and have any health checkup during the last 19 months. How do you think this is impacting the overall health? And do you think that apart from those 14%, everybody should, the question might sound repetitive because some of that has been answered before, but I think it's still very, very important to actually understand that how health checkup, preventive health checkup, may actually save lives.
Right. So I'll just come back to your question. Just I want to pick up on something that was said earlier.
Yes, please.
You heard this expression 40 is the new 30, orange is the new black. And one of the new expressions that I heard not too long ago is sitting is the new smoking. And you
Wow.
may have heard that. So sitting is the new smoking. You know, so much of public health messaging over the last 50, 60 years has been about smoking. Don't smoke, you'll get lung cancer, you'll get heart disease, you'll die of a stroke, etc., etc. And because of that consistent messaging, the incidence of smoking has actually dropped, has come down, particularly in Western nations and the US, and also in India as well. And I think a similar sort of a bombardment needs to be done about sitting, where sitting is as deleterious, as harmful to us, particularly this long hours of Zoom call sitting that people in the tech industry or fintech or finance and even general people who are on Zoom offices nowadays have to go through. So I just thought I would leave you with that expression, which is very thought provoking and really a strong expression, which is that sitting is the new smoking. Now,
I
coming to
think
your point about why and how people have ignored their health checkups in the past so many months, I think we have sort of come to the conclusion that we need to change that habit. And I think forums like this, where all of us get together and sort of consistently talk about the same theme, that the pandemic is in its next phase. I think, as I said earlier, if you've had vaccinations, it is time for you to wear a mask and get out and get exercise. Similarly, it is time for you to wear a mask and go to the hospital and start with your preventive health checkups that have been long overdue for the last 18 months or so. And I'll
fair
finish
enough.
by saying one last thing, which I think I'm paraphrasing Warren Buffett here, who said, very interesting, and I love this expression again. Chains of habit, he said, are too light to be felt until they are too heavy to be broken. And therefore,
Well,
I don't care too much about inspiration, all of these big words. I think habits are really what are key to changing our lifestyle. So get a good habit, stick to it. I think that will pay long dividends for your health and for your heart in the long run.
fair enough. I think sitting is the new smoking should be the tagline for today's webinar because it sort of evolves around the pandemic. It's a very well said expression. Whoever said that, whoever came up with it, very, very thought provoking and impactful, no doubt about that. Rawat sir, a question to you, and then I'm going to ask Dr. Nilesh, who is there. There is a viewer who is asking a question. Taking aspirin daily, would it reduce heart attack versus taking aspirin with or without doctor's advice? So this whole thing of aspirin, it's almost a joke in other specialties that aspirin cardiologists and sometimes neurologists pay such a big importance to it. It should almost be in the water. So is aspirin that important that it should be taken by everyone? General people, this is a question for general people who don't have any medical background. So just simple answer for them.
Yeah, aspirin is a wonderful drug. Now we have the aspirin for more than a century, and as you know, the heart attack process is nothing but atherosclerosis. And what is atherosclerosis? Is the deposition of the fatty tissue, deposition of some sort of a fibrous tissue within the arteries of the body. So it can block the arteries of the heart, kidney, brain, eyes, couple of places. Now, as fortunately or unfortunately, we do not have so much medicine to reverse the atherosclerosis. Once the problem occurs, like heart attack occurs, we do angioplasty, we give medicine to prevent further things. But the medication which can reverse the atherosclerosis, or rather the hold atherosclerosis, hold the progresses are very few. And one of them is the aspirin, the cheapest of all the medication available. So it was advocated anybody above the age of 65, irrespective of the things, and those were the risk factors like blood pressure, diabetes, hypertension, obesity, smoking, risk factor, they should start early. And couple of study has proved that aspirin in low dose do prevent or delay the onset of heart attack and stroke. So those who are risk factor, usually it is prescribed along with your all medications, and those who do not have, they always have concern of side effect of aspirin versus the prevention and long-term benefits. But if you take long-term benefits, if you tolerate the small dose of aspiration, we don't have to take 300, 400 milligram. Even 50 milligram of aspirin does wonderful job. So if you are cross 60, 65, if you are too much conscious about your body and heart, all the things, probably it's not a bad idea to start small dose of aspirin at that age.
Very good. I think that's very well summarized, sir. Um, Nilesh, one more reader question, one more listener's question. Sorry, I'm going to ask. We've heard this again, time and again, it keeps on coming that vigorous exercise post COVID 19 leads to heart attack. Is there a link, or is this a pre existing disease process which just gets aggravated, or it has got absolutely no correlation? Can we just clear up this question once and for all? Because this is a question which every patient of mine also keeps on asking me. So I want an
Right.
answer of that from you.
Right. I would like to begin with the concluding remark is that start slowly and build up, you will be safe. Post COVID, of course, there's so much of fear in patients who are especially at a higher risk with the other risk factors, the conventional risk factors, and it being a prothrombotic state. Now, suddenly you come back, you've been in the hospital and you come and start exercising vigorously. So then you are bound to land up in problem. Exercise is good, recommended for everybody with, without risk factors, with, without COVID. There is no doubt. But the tagline, the bottom line should be start slow and gradually build up. And unfortunate accidents, which I would call them as accidents because we do people, how do they wake up? Well, the footballer was suddenly collapsed on the ground and CPR was done, and suddenly he had a VTAC and AICD was put, and suddenly everybody starts flooding. And that, do I need an ICD because I'm a hypertensive patient? A marathoner was running, so that's plaque rupture. That's an accident which is unfortunate, but less likely to happen if you are in healthy lifestyle bracket, that is no smoking, no tobacco, very moderate alcohol, good diet, and at least 30 to 45 minutes of brisk walking a day.
Again, I think very well summarized that take it slow and build it up as you go. Dr. Vivek, you're back. So, one question for you. Has the pandemic impacted people's health in different way? In the context that the fear of going to the hospital has been so big that people are now. We talked initially about a lot of lot of people losing life because they could not present to the hospital. What about the symptoms? Are you seeing that they're coming in more sicker to you? Do you think that they're coming too late to you? It would have been better had they actually presented, say, a few hours before or maybe a day before when their initial symptoms started. What's your experience being? And then I would like a quick comment from all the other panelists as well on this question: that are the patients coming late to you because of fear of pandemic? Vivek,
Yeah.
main question is to you though.
Yeah, this has been a pattern that we have been observing. People have been experiencing chest pain for the last 15 days, 20 days, and they have been tolerating it just for the fear of going to the hospital and contracting pandemic. We have been doing online consultations. We have been asking patients who have been complaining of chest pain to come to the hospital and get admitted and get an angiography done. But they said that no, the hospitals are full of COVID patients. And then suddenly they call up one night and I'm having severe intense chest pain, he's not responding, etc., etc., and then they come in such a bad state that it becomes very difficult to save them. So they are just postponing their ailments for the worst time possible, and the golden period is being lost because of the fear of the pandemic and fear of contracting COVID. This has been a pattern.
What about Atul and Rawat Saab and Brijesh? All three of you could just give me one. Is that what you are seeing in your patients as well, that they are postponing coming to the hospital for a long time?
Uh, Shall I take? Okay. Rahul, it was fear, definitely. It was fear. A year back, people used to don't go to the hospital. And when we see the patients, what Vivek has said was absolutely right. They neglected the chest pain, they neglected the breathlessness, they neglected the hospital, fear of acquiring COVID, all the things. And what we saw at that time, a patient of heart attack coming on second, third, and fourth day. When you heart attack patient comes second, third, and fourth day, they are more complicated in terms of they have damaged their heart. Not only that, their arteries are full of clots and difficult to manage at times, and people get a better outcome. So this is what has happened now. But I think as the pandemic is settling down from the January onwards, I think we see more flow of patient coming much earlier. But still, fear of the COVID has not gone yet. Still certain people
Agreed.
have the some sort of a fear, some sort of a some sort of a yeah, this thing, going to the hospital. I keep on seeing the patient asking, shall it safe to go around? Shall it safe to go around? So that is not fair. I think the pandemic has gone down. Forget the pandemic. When the pandemic was active also, if you look at our hospital, we had differentiated the COVID and non-COVID specialty or services very efficiently, so that contracting the COVID for a non-COVID patient was very minimal. And
Yes.
that's how we managed non-COVID patient at that time. And today we have learned a lot, and we have been making the services more safe for the non-COVID patient, not only for the heart patient, but even for any of the ailment or any of the condition, any of the body disease. The non-COVID things are separate and more efficiently managed, and one should not delay their disease. One do not delay the symptoms. Don't ignore the symptoms. If you have symptoms, if you are not feeling well, be bold. Go to the hospital and assess and diagnose yourself. That is what my message is.
Thank you, Dr. Rawat. Dr. Limay, a question for you, sir. The pandemic actually brought out one more thing quite nicely, and that was the use of technology. And we used quite a lot of technology in terms of audio video consults, as well as Dr. Mahajan just said that they were doing video consults with the patients. So, where do you see this video consult? Do you see them staying as the pandemic weans off, or you would like to see your patients in the hospital, which is going to be much better and safer for you as well as for them to diagnose them in a timely fashion? Just your thoughts on that, sir. I know the obvious answer could be there, but I still would like to hear from you.
No, I'm sure. I'm sure this is a topic that can have different answers. I'll tell you something off the bat. I'm very bullish about the technology. I am very optimistic. I am very hopeful. I think if there is one thing, one good thing that has come out of this pandemic, it is this ability of patients to sit at home and be able to converse with their doctor. Because there are a lot of things that can happen over a video call. There are some things that cannot, and I'm cognizant of that. But there are a lot of good things that can. For example, I am very, very aggressive in having my patients buy blood pressure monitors and monitor their blood pressure at home. And over a video consult, patients can tell me what their blood pressure is. They can show me their latest lipid profile. I can be in a position where I can converse with them. I can counsel them to exercise, to go out, to tell them it is safe for them to engage in activity. A lot of things can be accomplished over a video consultation. What cannot be done is obviously acute care, and for that there is no substitute to a face-to-face encounter.
Of course, of course, of course. I think again, I share the same thoughts as well. I think technology is here to stay for good, and it's something which we have been a little bit worried about for a long time. But it's sort of broken those barriers, and it's really into our day-to-day life now. Dr. Nilesh, a different type of a question. You mentioned about people knowing that CPR needs to be done, but when you ask them actually what to do, they probably are not aware of it. Similarly, a lot of discussion has already come through where people mention that, yeah, they are aware that there are heart risks, but they still want to sit down and do things. Are we lacking in awareness programs? How do you think we should actually bring forward this gap, bridge this gap of knowledge versus exact reality of what it is? And if you have to sort of talk about bystander CPR, how many people you think should actually be aware of what a bystander CPR is and how important it is? Because we saw what happened on the football field, and we saw a few of the celebrities, unfortunately, falling to heart ailments as well. Have somebody known how to do a bystander CPR in any of those situations, maybe they would have had a little different opportunity to seek medical help.
I think catch them young and watch them grow is what I would like to say. So it has to come from right at the school level, the kindergarten level, because as we can talk as interventionists or as intensivists, even we at school level were never knowing all these things. So if we sort of ingrain this right at the bottom, and it starts at the school level as a subject, and so if the child sort of branches out into a commerce stream or a art stream or xyz anything, at least from the school he is trained well and knows the importance of a CPR. Because if we at this stage as healthcare workers, we go out in the community every Sunday, you're going to do camps and going to go to the society, go to the population, how seriously do they take? Because it becomes like, okay, there's a health checkup camp, Fortis has arranged, let's go, let's sort of get it done, let's listen to what the doctor says, twins are there, everybody is doing their bit. But how much? So everybody is aware that if a patient falls, CPR needs to be done, but what exactly needs to be done, unless it is hammered again and again through social media, through various platforms, I think we will always be falling short and feeling that even after having put so much of an effort, the end result is not there.
Fair enough. I think we are almost coming to an hour of discussion. And on this World Heart Day, I would like each one of you to give me some form of a, resolution for yourself, for your patients, for your community, for your friends. What would you, as cardiologist, as the torch bearer of the heart care in the country, in the world, the cardiologists are looked forward as the people who would actually save us, because what everybody is worried about is a heart attack and a stroke. And on a World Heart Day, I would really like you to give me a resolution so that the viewers can actually take it as a take-home message. Each one of you, starting with Rawat sir.
Okay. First important thing to make a statement is Nobody is immune from the heart problems. Okay, and don't think that I am immortal. I will not have the problem because I am very vegetarian life and all the things. Look at media and such sort of webinars and awareness program has definitely made the increase of the awareness of, among the people. Media has played a lot of role, and as I said, nobody is immune. You look at the best of the cricketers, Saurabh Ganguly, Kapil Dev, they have suffered the arrest and heart attack. You couple of headlines you must have listened in recent past that this company CEO, while doing the marathon or while daily walking, he has collapsed. So these are the factors are there. We do have the coronary risk factor like hypertension, diabetes, smoking, obesity, all the things. But remember, besides this risk factor, what kills us, what makes us more prone for a heart problem in the urban city is our job stress, overall stress, pollution, animosity, all sorts of problems and competition. These are the other risk factors which has emerged in the urban areas. We need to combat all the conventional risk factor, other risk factors, make awareness of the disease process among the community. People should know the awareness, as Atul put forward. Start your examine yourself, start to doing blood tests as early as possible, 20, 30 years. Get your heart checkup done. Those who are risk factors, they should do it more early. Those who have family history, they should more early. Not only that, one important aspect of this study was a lot of young people are aware about the things, and young people aware has two aspects. They can take themselves as awareness and the fitness program, no, and looking at this lecture and all this awareness and questionnaire in coming to the knowledge of this thing, they can look after their elders also well. So overall, I think the unless people make the self reliance, self going ahead for the self diagnosis, self assessment, this won't occur. And we are the part of the community. We should spread the message. We spread the message. Take much more webinars. Maybe the health camp, health camps of couple things, and make the awareness of heart disease and try to make community heart attack free as far as possible. Thank you.
Thank you, sir. Dr. Limay, your resolution for the day. I'm just going in from the way you are appearing on my screen right now, no particular order. So,
That's okay. My resolution is to encourage my patients to get up and go out for a walk. Simple. Simple resolutions, not too complex, not complicated. Just get up, go for a walk. Make it 30 minutes and slowly increase it to 40, 45 minutes. And then once that is done, then we can talk about the other things.
yes, yes, sitting is new smoking. I think that's the tagline. That's the most important message is come out.
That's it.
Dr. Vivek, you are the
Yeah.
next one with the
I have
resolution for
four.
the.
I have four important one-liner messages for my
You are
patients.
organized. You're organized.
Yeah.
Yes, go ahead.
So sitting is the new smoking, and so move more. Second is change to a healthy diet plan. Third is get your health checkups done regularly, and fourth is learn CPR.
Perfect. I think very well said. Dr. Nilesh Gautam.
Yeah, I hope there is no patent on smoking. Sitting is the new smoking, because I'm going to use it. Definitely, I'm going to use it. That's my first thing. Gift yourself an annual health checkup on your birthday. The best you can do. Don't take life too seriously. Targets not to are to be met whenever the time is right. There is more to life. Develop a hobby. Be stress free and enjoy it. Thank you.
Well, thank you very much, Dr. Brijesh. I think it just dropped off. So, thank you very much, gentlemen, for a very, very insightful discussion. And the questions surrounding the survey were very important and very interesting answers and very interesting findings of the survey as well. On this World Heart Day, I thank all of you for looking after our health and our heart. And each one of you is a gem in yourself. And I think the resolutions which all of you said are truly inspiring and should be taken up in a very, very serious way by community at large. Thank you very much.
Thank you.
Thank you.
Thank you.